Well, we can tell you tonight that health officials are also pleased to now apply the antiviral drug Remdesivir to treat local COVID-19 positive patients, although a vaccine is still in the making. Jimenita Swain got this update today.
The antiviral drug Remdesivir is now being used for the treatment of COVID-19 cases locally. Health Minister the Honorable Granwood Wells announced this week that 150 doses of Remdesivir has already been secured. For consultant and director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes, the drug approved back in October by the United States Food and Drug Administration calls for a specific criteria that must be met for patients using the drug.
We're very happy to have the supply of Remdesivir. This is the first FDA-approved COVID treatment. There's an indication for it. It's not for everyone who has COVID. Because, as you know, there are persons who have COVID that are asymptomatic. It's estimated that could be about 40% of the persons with COVID in country. Then there's also many people will have a mild form of the disease. Up to maybe 80% of people may do just fine, but it's the moderate to severe COVID-19 patients who are hospitalized requiring oxygen or respiratory support, really.
Dr. Forbes said the study showed that the drug reduced recovery time in patients from 14 to about 11 days. With more than 6,800 persons testing positive for COVID-19 in the country, Dr. Forbes notes that as many focus on a cure, many questions remain.
A lot of work being done with vaccines. There's several vaccines that are still in clinical trials. And the question is going to be, what will the vaccine do? Will it stop you from getting COVID? Is it going to make you have no symptoms? Is it going to stop people from getting terribly sick? Is it going to only give you a mild course? And so what is going to be, what is the result of the vaccine? What is the marker or the efficacy, the vaccine's efficacy? And what is that going to look like?
Forbes emphasizes the vaccine will not supplement a cure.
What we have to remember is when there's an available vaccine, whenever that will be, whether it's the end of this year or next year, it's not going to be a magic bullet per se. Even if it's available, it's going to take time for the world's population or a country's population to get the vaccine. It's going to take time for vaccine uptake and people to take it, and so it won't be instantaneous.
And while lab-confirmed and hospitalized cases are decreasing, Dr. Forbes says we are not in the all clear as yet, and these elements are also being considered.
For example, if you have a shutdown for 2 days, less people may get testing. There could be trends in terms of the way labs are reporting. They could be, I don't know, I'm just saying theoretically, it could, be cohorting batches of samples and reporting maybe every other day, for example. And so there are things that influence test results. It's called reporting bias. It is encouraging if it is going down, but we're not out of the woods yet, and we cannot become complacent and breathe a sigh of relief too early.
Dr. Forbes reminds residents that adhering to COVID-19 health and safety protocols of washing your hands, wearing masks, sanitizing your surroundings, and practicing social distancing are primary prevention tools in fighting COVID-19. Jimenita Swain, ZNS Network News.